If you do have a doctor's appointment at Kaiser Permanente this week, you may need to reschedule that. That's because more than 75,000 Kaiser employees are on strike.
Unionized workers have walked off the job, and they're planning to do that for 3 days starting today. This could become the largest healthcare strike in U.S. history. Let's get to ABC 10's Bridget Biorla joining us from Kaiser South and Sacramento. We can hear them behind you, Bridget. What are they asking for?
Yeah, Bria, this strike just started minutes ago. You already see a big turnout here at the Sacramento Kaiser location. We have a lot of folks out here wanting higher pay, more resources. You see the signs, respect and value healthcare workers. Kaiser put patients first. Kaiser workers on strike. Now, this won't affect physicians and nurses, but it will affect a lot of the hospital staff, including lab techs, medical assistants, and other support staff that help keep the hospital up and running. So I want to bring in Gabriella Roche. She's a respiratory therapist at Kaiser. Gabriella, what is this all about? What do you want to see from Kaiser?
Thank you for asking, Bridget. We're here fighting for our raises. Inflation is at 9%. Kaiser's offered us a 4% raise for this year and the next 4 years. That's not going to cut it. That's not enough to keep up with the cost of living. We're here fighting for our benefits. Those who've devoted years of their lives to Kaiser, we want to see that reflected in our retirement. We're here fighting for staffing. We've been short-staffed for years. We just want Kaiser to hear us, to bargain in good faith with us, and to give us the respect and the care we give to our patients.
How are the negotiations going? Because you've been at this for some time now. You work through the night. Are you making any progress with Kaiser getting your demands met?
Kaiser has finally started to bargain with us. We have been bargaining since April. Only last week did Kaiser actually come to the table with any type of proposal. Up until this point, they have not met any of the proposals the union has given them.
All right, thank you very much, Gabriella. And of course, all these concerns have been exacerbated during the pandemic when a lot of hospital staff retired. The workload really increased for a lot of these workers. They're burnt out, and they say they're not being compensated fairly enough. So do expect the emergency department to still be up and running, but you're going to see the impact in other patient care. So make sure you go to kp.org to see if your appointments are impacted, but Kaiser says they will be alerting you if your appointment needs to be rescheduled, so you don't need to call them directly. Bria?
Really great advice, Bridget, there. So we just heard from Gabrielle about what Kaiser's workers want. How is Kaiser Permanente responding to all of this?
Well, you heard Gabriella say they worked through the night till midnight at the negotiation table. So we just heard from Kaiser. I want to read you a quick statement of what they're saying. They say both Kaiser Permanente management and coalition union representatives are still at the bargaining table, having worked through the night. In an effort to reach an agreement, there has been a lot of progress with agreements reached on several specific proposals late on Tuesday. So I can tell you, Bria, that this strike is expected to last 6 a.m. to 6:30 p.m. every day through Friday. I'm told it will not go into next week if an agreement is not met, but it will pick up again in November. So this will last for some time if they can't reach an agreement by end of week. Bria?
All right, Bridget, we'll have to see what happens with this. Thank you.